MD, Psychology and Family Medicine from Christian Medical College in India. She worked for 5 years in a preclinical research and preventive medicine, where she actively engaged in hypothesis testing, data analysis, scientific writing, health promotion, and patient education. Clinical medicine has been her passion, and healthcare innovation is her interest. She aspires to contribute to the healthcare sector in Canada. Thank you so much, Dr. Sweta, for being here today.
Thank you very much. So shall I go ahead and present the PPT? Okay. Is the presentation visible to all? Okay. So I'm basically looking at how nutrition has affected Canadians post-COVID. So coronavirus, all of us know what it's been doing to us. It's been more than 8 months that we've been acquainted with this virus. We know it comes from bats and it's a viral issue. Why is this viral issue a problem for humans is because humans need very good immunity when it comes to viral infections. When it is bacterial, we have antibiotics which could aid us, but with viral, it's purely our immunity. We do have symptomatic treatment for it, but there is no drug as such which could directly target this virus. So what is immunity in humans? We actually have two kinds of immunity. One is natural, which comes at birth itself, produced in our body on its own. And we have an acquired one, which comes over a period of time. It could be due to environmental factors. One of the factors being nutrition itself. So immunity is basically given by these cells called as the white blood cells. When it is a natural one, it's called a natural killer cells. And over time, when we acquire more amount of immunity, one of the WBCs is called lymphocytes. Why I'm focusing on lymphocytes is because when it comes to viral infections, lymphocytes are our defense mechanism. So when we look at lymphocytes, So lymphocytes, there are two kinds. We have the T cells as well as the B cells. T cells are basically like the policemen. As soon as we have a viral infection, they go around in the blood looking for the virus, break it down, and protect us. What B cells do is they produce something called as the antibodies, which is sticking out of the B cell. It throws away these antibodies, which starts moving in the blood. And whenever it sees a virus particle and its antigen, it goes and binds to it like a jigsaw puzzle, and it produces our immune response. So these are the antibodies which get produced by the B cells. They go and form a web around the virus. So when coronavirus infected few of the humans, what it did is it went to the cells and sat on it. And that's when our body's antibodies, as well as the T cells, they wake up to produce the defense mechanism. They go and form a web around this virus and protect us. So inside our body, when there's any kind of infection, this is what is happening. Our body is like a war field, and you have our immunity. In case of viral infections, it's the lymphocytes. They are our soldiers. And we need more of this immunity and more number of soldiers in order to break down this virus. A virus, when it enters our cell, in a few hours, it can multiply very fast. So you can have tens and thousands of virus coming out in few minutes to few hours. To face that kind of an attack, our immunity has to be very strong in order to keep us healthy. So why is nutrition important, especially during COVID and post-COVID? Primarily the immunity that I told you about. Without immunity, we wouldn't be able to fight this COVID. And for the immunity to develop, diet plays a major role in us from when we are born till later. And nutrition is important because if a patient has already been attacked by COVID, it aids in its recovery. And for some people who have a good immunity, the recovery is faster. If their immunity is low, the recovery could take a longer time. And it also builds the muscle strength. So in case of a COVID infection, the muscle starts breaking down, metabolism gets affected. So muscle strength is very important. Again, muscle strength is directly related to what we eat, the amount of protein we eat. And nutrition is important to prevent any kind of comorbid conditions. Comorbidities are some things like especially diabetes, hypertension, obesity, and heart disease, because these are the patients who have been targeted during COVID, and they tend to have a lesser lifespan, mortality rate is higher for these patients. So this is the reason nutrition plays a major role even during COVID as well as post-COVID, where all of us have to be aware of what we eat. Till date, the government of Canada hasn't approved anything that prevents, cures, or treats COVID-19. So when we look at the Canada's food guide, they stress a lot about the eating pattern, especially during COVID. They talk about a healthy eating pattern. So what is a healthy eating pattern? Canada's food guide says that plant-based foods are the best diet, especially to fight an infection, one of the main infection right now being COVID. So plant-based foods mainly includes the fruits and vegetables, the whole grain foods, which includes wheat, rice, and quinoa. So these are the aspects we should focus on in our 3 meals. To have a lot of pulses mainly being because it's going to increase the protein, which in turn will aid in muscle strength. And to have the good fat. Good fat, we see it in nuts, avocado, in olive oil, in different kinds of oils, like sesame oil, peanut oil, and to have fatty fish. These are the sources for the good fat and to avoid the saturated fat. So basically, Canada's food guide says have more fiber, less fat, and few or no ultra processed food. So processed food is okay, but it depends on what the processed food contains, the amount of sodium it contains, the amount of cholesterol it's going to build up. When it gets ultra processed, that is not giving us the right nutrition to fight infections. So the food choices we make in a healthy eating pattern is always related to our taste, culture, budget, as well as lifestyle. So this is one of the other point Canada's food guide stresses, because if it follows all the 4 of these, the person usually tends to follow a healthy eating pattern in all their meals without changing it too much. If one of these factors are affected, they tend to change the meal, which is not very nutritious. Another thing that it talks about is about replacing sugary drinks with water. Water as such is very important when we're fighting infections because it maintains our body's water content, prevents dehydration. Also, sugary drinks can lead to issues like obesity, type 2 diabetes, which is also a comorbid condition which fastens the COVID-19 infection. And to avoid processed foods, like I said, main reason being there is excess sodium. It could have a lot of sugars and a lot of saturated fat. So the excess sodium could lead to comorbidities like hypertension, heart disease. Sugars can cause obesity, diabetes, and saturated fat can also cause obesity. So these are the patients who are affected very easily during COVID. This is another reason it's said that to avoid processed foods. Why the nutrients that are critical for the functioning of an immune cells are these. So that is mainly the vitamins, A, C, D, the vitamin B complex, zinc, selenium, iron, as well as protein. So we should see to that our diet, which we consume on a daily basis, should have these components in order to have a good immunity. And the sources for this are very well available in Canada's food guide. So based on our taste, culture, and lifestyle, we could choose the ones which suits us the best. It's available in plant foods as well as in animal foods. And there is also specific nutritional needs for older people. As we know, older people have been a big target during COVID. We've seen that in the long-term care centers as well, where they were massively hit. A reason being, as we age, we are prone to chronic diseases. We are prone to a decreased functional ability. There's always a cognitive decline and higher chances of a disability. And aging adults are always susceptible to a decrease in the body weight. It happens faster. They lose their muscle mass very fast, and there's a loss of appetite. The minute there's a loss of appetite creeping in, their nutrition is going to go bad. They wouldn't be having all the meals. The content might go wrong, which in turn makes them susceptible to an infection. So nutrition actually plays a very crucial role to fight COVID, which we have realized in the past 8 months. So this, as I said, this is what is happening in the body. And to maintain the immunity, we need to eat the right food in order to fight away this infection. But it's very easily told that nutrition is important. All of us should follow it. But can all of us follow it? That is a question. We have something called food insecurity, which is cropping. It has already cropped up. globally, not just in Canada, it's happening in many countries where a lot of them cannot afford the food that has to be taken on a daily basis in order to have a good nutrition, in order to fight COVID. So they become the vulnerable ones who will get affected by COVID. So it's called as the global food syndemic, where along with the pandemic, we have this food epidemic that has grown in the past 8 months. This is a transcontinental food emergency which has to be addressed more aggressively. And the ones who are getting affected are the vulnerable population, and they will continue to get affected because they end up being in this vicious circle where they're not able to afford for that nutritious food. The main pillars of a stable food security system are two. That is the food availability for a person and the food accessibility. So what happens in a global food syndemic? There is a food insecurity which continues to grow. Just a minute. Yeah. Where not all of them can access the food or consume the food which has the nutrition, which in turn leads to the malnutrition and obesity, unhealthy diet either because of an underconsumption of good food or overconsumption of nutrients, which again increases the vulnerable class. So when vulnerability increases, there is a higher chance of non-communicable diseases starting off, which is not good for COVID. And it also worsens the outcomes in case of situations like COVID-19. So food insecurity is something that has to be addressed very aggressively. And this is happening in Canada as well since some time. So what COVID has done to the food security system is it's magnified the complexity. This issue is already a very complex one. It's just worsened it. And it's highlighted the fragility of our food structure. So this is happening in all provinces. The Northern Territories are affected the most. It's also present in Ontario. So this is a study which was done by Proof in Canada, where they saw that over a period of time, even in the past 10 years, the food insecurity has only been growing. It hasn't reduced. And it's grown by almost 1 million in the past, in a span of 7 years. And in Canada, 1 in 8 individuals always undergo food insecurity. Post-COVID, this has worsened. Every 1 in 7 individual is undergoing food insecure issues. So there's always an imbalance. If we look at the first pillar, food availability, it's not completely balanced. With COVID-19, the supply chain has got affected, right from the individual farmer to the local communities, and then to spread it globally and to sell it globally, the entire chain has got affected. And the workforce has reduced. The main reason being, a lot of these farmers are the temporary foreign workers who are coming in to do the farming, and that has completely reduced during COVID. And the supply is getting higher than the demand for few crops. So there's something called the meat and potato problem, which came up with COVID-19. There is a lot of meat and potato with the farmers, but none of it getting sold because the restaurants were closed, schools were closed. So the supply ended up being much more. And there is a dependence on imported produce as well. So Canada not exports products, but also it ends up importing a lot of fruits and vegetables. So there is an imbalance in the food availability itself. There are some foods which are available in plenty, and there are some which ended up going to the lower side. And the second pillar, food accessibility. Not all have the accessibility to good food and nutrition. And we can see all these classes are being affected by it. The maximum is by the group who are under social assistance. They're the ones affected with food insecurity. The rest include the ones who depend on the seniors' income and the daily wage workers, and even the workers who have employment insurance or workers' compensation have food insecurity. And it also affects based on the race. The maximum hit during COVID were the Black population as well as the indigenous people. And it also, food security also depends a lot about the presence of children in a household. So the households with children led by female lone parents were the ones who are more vulnerable to food insecurity. And every 1 in 6 Canadian children under the age of 18 are being affected by it. During COVID, the Canadians who were unemployed, who lost their work, who were absent from work, they were almost 3 times more likely to be food insecure than the ones who had their jobs. So in order to address this food insecurity, measures were being taken since some time. And during COVID, they ended up giving the Emergency Food Security Fund. It was in the month of April. in order to aid the vulnerable population. And this fund was sent through these 5 organizations: Food Banks Canada, Salvation Army, Second Harvest, Breakfast Club of Canada, and Community Food Centers. So these 5 organizations then distributed that fund to the local organizations, which then went to the communities. Now, in the month of October, that was yesterday, Prime Minister again announced an additional support of another 100 million for the food banks and local food organizations. But the question is it the money which comes to the food banks important, or is it the money which the individual earns is important? Because with the studies done by Proof as well, it shows that the food insecurity, the issue is not about the money, food coming from the food banks, but the issue is about an individual being able to afford that nutrition. So the income itself is the root cause of it. So the study done by them shows that we already have 4.5 million people who are food insecure, and the food bank users are only just 1 million. That is a huge difference. You have 3 times more population who do not have access to the food banks and are going to be the vulnerable ones getting affected by mainly COVID and even the other infections. So there is always the question, is this money enough, or should there be more policies in order to address this food insecurity? Because the root cause, again, it has been found to be the income of an individual. So there are a lot of factors when it comes to food security in Canada, and balancing it requires a lot of policy making, a lot of rethinking. It's not an easy job, and hopefully that is solved sometime in future, especially after seeing what has happened during COVID. Thank you.
Thank you so much, Dr. Shweta, for your presentation. It was very informative. Thank you so much.
Thank you.
Our second panelist is Dr. Shafi Bijan. We are so pleased to welcome him. And for me, it's really an honor because this is one of my mentors at Rayoso University. So thank you, Dr. Bijan, to be here. So Dr. Bijan is an award-winning faculty member and international recognized program builder, academic, professional, leader in global health training and education initiatives, with diverse experience in both developed and developing countries. After finishing medical school in Bangladesh, he worked as the founding coordinator of Maternal and Child Health Research and Training Institute, where Dr. Bijan focused on capacity building training of health professionals. Following the completion of PhD, he worked as a research scientist and faculty member on Osaka University, Japan, and Mahidol University, Thailand. In 2010, Dr. Bijan immigrated to Canada, where he began a new career focus on how equity-informed approaches can improve health service and healthcare training. Over the next several years, Dr. Bijan moved through successfully more senior positions, so that today he's a faculty member and board Rayoso University in the Department of Community Service and at the Dalai Lama School of Public Health, and chair board of directors Canadian Coalition for Global Health Research. Also, vice chair board of director in Birchmount Blow Neighborhood Center, Scarborough Southwest, Toronto, Ontario. Through this career, the focus has been on improving how we deploy and redefine public health resource, whether the line of training programs to improve health system performance and the equity of health system performance in local and global contexts. He is a co-founder, academic director, and program manager of the Innovative International Training Medical Doctors Bridging Program at Rayoso University. We provide IMTMDs with training to transition into non-licensed healthcare position. So, as I mentioned today, we are pleased to welcome Dr. Shafi, a very special guest today. So, and with that, I just again giving your full attention to Dr. Shafi and help in welcoming him to the stage. Dr. Shafi?
Yeah. Thank you, Excellence. Thank you, Magdalena, for your very elaborate introduction, kind introduction. And I really appreciate my senior Professor Alungir is here, and all my students and colleagues is here, and webmaster is Abby is here. So I'm not enough competent to run multiple web programs, so I'm learning. And thank you, Abby, for teaching all these good things. And thank you all the participant and speaker. I really truly enjoyed the previous presenter. She nicely mentioned about the food, which is my concern. Just today, maybe 200 million, not 100 million. So I correct the government of Canada the allocate. Just I saw in the CP24 morning news. Anyway, COVID-19, I was asked to talk about two or three things. One is the how COVID impact despite of lockdown, the economic impact. So I have a exciting discussion this morning with so many people from around the world, the British, US, and other country about the palliative care, how is impacted. You'd be honored to know that around the world, about 40 million people are required for palliative care. So, but if you see in the Southeast Asia, maybe more 18 million people. And if you split into Bangladesh, around 800,000 people need palliative care. But only our capacity is exists only for 18,000 to 20,000 people are getting support somehow, somewhat. So you could imagine 0.026% people getting support. So we have to do a lot of things. And COVID showed us very nakedly that we need to emphasize capacity building of the providers so that they can support our people. Because one thing I believe that we have a huge deal, government arrangement, social arrangement, community arrangement that a baby is coming for delivery, right? Safe delivery, pregnancy. We welcome baby to come to the world. But when somebody is going to die, we never give them that compassionate service. So last moment they can survive with dignity. So we just let them go, or I have nothing to do at much, so which is not right. So that which is not inequity, which is not social justice. So that is now new things coming up. Anyway, as if I would like to talk with economy, it's also that also matter, right? A lot of lost opportunity. Now we need to learn from each other. What happened globally, 35 million or more. Abby can chat box can give the latest number as of today, how many people attacked, and maybe over 1 million people is lost their life. So I really feel sorry for that. But there is a not only they are dying, give us a lesson also. We have to do a lot of unfinished tasks. What is it? We see the US, the India, the Brazil, the Russia, Mexico, Italy. They're the major champion to contribute this kind of death or infectious rate. But no one in the world is immune to this attack. Somehow we all are under attack. So what is this attack? This COVID give us around over 500 million people under the poverty right away when it kicks in last January, February, March. And it means when I talk about the poverty, less than $5 or less, they are capable to survive. So if I go to the in general to the world, GDP is just shrinking around 7%, so that people all economy will be impacted. How and where? If you see the Southeast Asia or East Asia Pacific, about over 368 million or 370 million people are affected directly with this poverty. About the Latin America, because I know our host Magdalena also came from Mexico, and we can see 54 million people are attacked. So even though we are very proud American nation, but we are under attack. If you see the Middle East, who are the well-rich country, and North Africa, also 45 to 50 million people attacked. Sub-Saharan Africa, also around over 44 million people under this crisis. And if you think about the other European country, including Central Asia, about over 30 million people also under these circumstances. Think about a high-income country like Canada and other, also 4 to 5 million people already affected. And you can see government recovery plan, billions of dollars, even trillions of dollars coming to recover these things. When we were in the recovery stage, just yesterday, single day majority infection happened even in Canada, so which is alarming. So what is affecting not only economy, also is impacting our mental health, psychological background, which is actually beyond your calculation of the number, what I said. So it's not billion or trillion, it's destroying our morale, our strength, so that about 34 mental health percent people need immediate mental health support. About 50% people need psychosocial support. So this also cost huge if you calculate in dollar value. So I think only simple knowledge can help us. Can you imagine what is this simple knowledge? We just need to go ahead with the Zoom meeting, physical distancing, and wearing the mask when you go out, limit your hugging or kissing, and also wash your hand every time whenever you go, wherever go. 3 simple things we learn in the village. So now we need to apply in even the civilized, highly mechanized, civilized society. But we are so impatient. When case was going down, we just go out to the beach, a shopping mall, and we start everything. And now cases again up. So it's up to us how we can control our economy, how we control our future. So that is the most alarming thing. It's not hitting any single country, it's actually hitting everyone. And is not only economy, is not only health, is a social crisis. It is the matter of inequity, is a matter of health system broken, is matter of addressing work need to be done collaboratively. So this is the lesson we learn, adopt, and collaborate each other. So that is my first take. And I want to say one more thing. The public health is only heated by this COVID, not only public health professionals. I think we have a joy of learning, because not so much people in the world who in their lifetime is a public health specialist or public health frontline worker like us to have experienced this kind of massive pandemic. So we know 17, what is it? I don't know. Can you remind me the year? Maybe 1870 or hundreds of years ago, the pandemic happened. But we have not much we can learn. There is not much documentation as we today. Now we have a mask policy. Now we have a social distancing policy. Now we have a evidence what works, what not works. Now we have a economic reopening plan, phase 1, phase 2. All this systematic approach, which is a good thing in another way, is the greatest lesson learned. Not all bad. So also, as you know, Einstein said, any difficulty situation, the opportunity lies. So that is easy. So in the morning, wake up in the early morning, I have a 2 call in Japan and the call in Bangladesh, and we talk about these things. You see, so it's not all bad. We can learn from each other, and I am so thrilled. Bangladesh, one of number 1 business tycoon, and also advisor to the Prime Minister. He was with us, and he said, "I learned a lot. The palliative care exists in the world, and it can help. It can be possible by private, social, corporate social responsibility." And he's just thrilled to know that. I said, "Not you. I also thrilled, because until Professor Eke knows that in our medical school, we never learned one single word, if I do not do the mistake, what is palliative care. Never. I don't know, you agree or not. So no curriculum teach us anything. So until I go to Japan in 2000, when I see the medical student working to support after the class, to support the palliative center. That's what I know, actually, just 20 years ago. But palliative care exists before I born in 1964 in England. But now already 56 years old, the total separate discipline, but we don't start yet. So we have no capacity yet. So anyway, this baby step work is also required resource, and also required initiative, and it's required most important, not only economy. We reach from low income country to middle income country already. We have that status, those $100 to $1,400 GDP. So, but what we have done, one thing lacking is create the empathy, which dollar value is much more than the money. I don't want to talk about too much economy. I want to talk about the empathy. So which COVID gives us to think about. As a physician, as a social worker, we always think about individualistic way, but we never come forward to serve as an empathetic person, not sympathetic person. So empathy is the game changer here. So I think COVID not only hit us as economically, but mentally, spiritually, they enrich us to come together to develop our empathy to support each other. I think economic loss is possible to recover, but empathy is a huge gain, I think, for the society. I don't think all are bad. So this is the number one. That's the Magdalena was asking me to talk about the economic, right, Magdalena? Did I cover everything you want for your first question?
Thank you.
So, thank you, Dr. Shafi. Thank you. We are going to have the third panelist.
No, I have another question. So you just, I don't done yet. I just talk about the first question.
Sorry.
Oh yeah, I can do whole day over one topic, but I will be brief. So the crucial action you asked me to talk about, I can see, I recall crucial action to take, help prevent this economic depression. Oh yeah, this is very important. When you talk about the crucial action, you need to think about the prevention or response. I call it early warning, rapid response. You need to come forward with a plan how to respond. That's Canada in a good way. And also global collaboration, so that all the country we gain the experience, we share from each other, and we learn from each other. And also one thing recently we did, global diplomacy of COVID-19 vaccine. So which is now after the mask, I think mask is the vaccine now. After the mask vaccine came in the market, before came to the market. So we have to think about how to think about other people. Like Canada did a good job from Canadian Coalition for Global Health Research as a chair, our board responds to the government that not only saving Canadian, we need to think about other people out of the box. And Canada government also kind enough to allocate this money to support the COVID vaccine purchase through the Gavi, so that other country can get this done, because a huge social support required, and many developing countries, they don't have access. That's why I said compassionate service, and also inequity and social justice. And you know, as a Canadian, we are very proud that we have a diversity, we have a understanding to support each other. What kind of support? Because health crisis is not anybody's fault. It just happens by virus, right? So where there's inequity, we have to move forward to go there. And how it's possible? We have to learn from each other, or trained health professional. So quickly should catch up to address the inequity, accessibility of the health system. And also, most importantly, domestic violence. You know, the many things are is not unheard of, but sometimes it's not words not get out. But COVID also aggravating this situation. When people staying at home, sometimes what to do? They just fight each other, right? And then cause a lot of anxiety, a lot of stress, lot of distraction. And third most important is, in my mind, is elderly care disruption. So we need to address now right away, because our grandfather, grandmother, or other seniors, they need more support, but they are now confined in somewhere. You can see in Canada, the mostly senior house, citizen house, nursing home is mostly attacked. 50% of the death is coming from there. And that's why we are working with the Commission of COVID-19. So how we can improve. And I had the opportunity to access to the Commission to write a special emphasis with the WES and other people, how we can help support all the people working for IMD or ITMD. We sit together recently, and we are trying to reach out to the Commission to give the opportunity to make a new structure how this health professional can work in the system, like building a special directorate like long-term care chief medical officer and long-term care east, west, south medical officer under the associate medical officer or health officer or community nursing home coordinator or specialist role by engaging multidisciplinary people, doctors and nurses from around the world. And then what we see, the low-income people are losing the job. So that is also another hit. So how we can give? That's why you see the government is giving package so that people can keep continuing their job. And overall, we need the solidarity to understand how we can manage. If we think about the financial breakdown happen in all sectors, not only health, agriculture sector. You can see if a farmer cannot go to the produce, even the produce they cannot supply chain is not active, is hampered. Also, you see the hospitality zone, the hotel and transportation, tourism is crashed by this virus consequences, and business are going to collapse. Some stock market already broken and going to the threatening level. And sports recreation, just today I heard once we start the community center, but now today it's closed. So we have to find a way to do it outside. So if you think Canada, I think we are doing great job. Billions of dollars government is allocating to overcome this situation. But I think we need to think about that world is changing. There is no way to think we can go pre-COVID situation. There is no way. It's a new normal. I can tell you in my experience, and it will never come back. Today is today, and we need to live our life today, because life is not a rehearsal. We need to enjoy our time. We need to work together to support each other, learn from each other, because today's crisis may open the door for cooperation to improve our empathetic channel right now without any delay. But that's why we need to educate ourselves. So education is the key of all this problem. Education is the solution, and this only happens with ethical leadership, so that we can achieve the goal of what we are ambition for. And that's why let's work together, learn from each other, and we should be stronger together, and we should be always moving forward.
Yes, Dr. Shafi, it was great. And yeah, we'll come to you again. After that, we'll hear from Dr. Safa, because we have 2 more questions, and you are the leader for this. Thank you very much for your leadership in this sector. We'll come to you again. Meglona, can you request Safa for...
Thank you, Dr. Shafi, again for your presentation.
We'll come to you again. It's great. We are enjoying.
Yeah. So our next panelist is Dr. Farhana Safa. She's gonna share with us her expert opinion in mental health impact and recovery during COVID-19. Dr. Farhana, welcome. So she is an international trained physician, a research public health professional, and a mental health counselor. She completed her graduation in medicine and surgery, including 1 year on internship from one of the prestigious and government medical college in Bangladesh. Due to her immense research interest, she enrolled in the MPH program, majoring in epidemiology, and obtained the Chancellor Award and Summa Cum Laude Award for her extraordinary academic achievement. She worked in various educational and private institutions in Bangladesh, and has more than 5 years of experience in quantitative, qualitative research, project management, stakeholder engagement and partnership, health promotion, counseling, community engagement, and knowledge transfer. So she has completed Master of Science in Community Health, degree specializing in addiction and mental health from the University of Toronto. She's currently engaged as a research assistant in Cambridge and Punjabi Community Health Service. She also works as a part-time mental counselor at the non-profit organization in Toronto. So, being a South Asian originator newcomer, she is interested in working with newcomers, refugees, immigrants, and at-risk population groups, aiming to improve the quality of life of community residents through public health programs and research. Thank you, Dr. Farhana, to being here today. And again, I ask you, all of you, to put a full attention to Dr. Farhana and welcome her to the stage. Thank you, Dr. Farhana.
Thank you so much, Magdalena, for the introduction. So I was trying to share my screen, but there is some problem. It shows host disabled participant screen sharing. So can you please turn on the screen sharing for me so that I can share my slides? I wanted to share my screen to...
I have done for you.
So, okay. Okay, it would be good if I can actually control the screen. Okay, no problem.
You want to say you can do it. You are the co-host.
I'm the co-host, but I don't know. It shows host to disabled participant screen sharing. So,
can you try? Can you try?
Okay. Yeah, it's open now. Thank you so much. Thank you. Yeah, are you all able to see the screen?
Yes.
Yes, that's great. That's great. So thank you so much for the invitation to speak here today in this panel discussion. It's a privilege for me to speak here as a panelist on the mental health impact and recovery during and after COVID-19 pandemic. So first, I'll start off with some background information. We all are aware of the fact that COVID-19 pandemic imposes a great health and economic risk worldwide. In Canada, mental health issues are gradually increasing among different groups of people, such as children and adolescents, also young adults, seniors, and also in the vulnerable population group. So the fear of contracting the virus, uncertainty about the course of the pandemic, as well as the unprecedented aftermath of extreme curbing measures such as stay at home and physical distancing guidelines, childcare and school closure, the limited access to health, community and social services, also workplace closure, and closure of outdoor and community spaces, those are implemented to stop the outbreak, have overwhelmed many individuals, leading them to feel helpless, frustrated, anxious, and stressed in the face of these new difficult and threatening experiences. So although reopening has taken place in many places of Canada, however, from the right-sided graph, it is visible that there is a recent spike in the number of cases. As of yesterday, that is October 9th, there were more than 2,500 cases were identified in Canada. Therefore, we are not sure what will be the upcoming situation. And we are also not sure if the second wave of the pandemic is approaching or not. So what is the mental health consequences of COVID-19? So research on large-scale epidemic and pandemic showed that there is a substantial increase in post-traumatic stress disorder, substance use disorder, a broad range of mental health disorders, including anxiety and depression, domestic violence, child abuse during this pandemic and post-pandemic period. There are many other, but I have highlighted the most important ones. So since the beginning of this year, a significant number of research has been documented in the literature base on the impact of COVID-19 on mental health. However, the long-term impact of COVID-19 is still unclear. All the studies we have in the literature most of them are cross-sectional studies, and there is no longitudinal studies are available. So still we are not sure about the long-term impact of COVID-19. So given this uncertainty, absence of vaccine, and implementation of various public health measures, this pandemic has been a stressful situation for all of us, and it is high time to discuss about the evidence-based strategies to deal with this stress and anxiety. So what can we do to protect our mental health during and after COVID-19 pandemic? So the answer is to build resilience. I know that there is no easy way through this crisis, but building coping skills and resilience will help us to work through the emotional upheaval triggered by COVID-19. So what is resilience? Resilience is the process of adapting the face of adversity, trauma, tragedy, or other significant sources of stress. It is the ability to keep going when things get tough and making the necessary adjustments to live adaptively despite the changed negative circumstances that you are facing. So there is a recent paper on stress and coping in the time of COVID-19, pathways to resilience and recovery. This is a very recent paper of 2020, and this paper highlighted some coping strategies such as behavioral activation techniques, acceptance-based coping, mindfulness practice, loving kindness practice, etc. So these all 4 techniques, coping techniques, these are adapted from previous pandemics and epidemics in managing stress and cultivating resilience and recovery during this tough time. So in this presentation, I'll be discussing some evidence-based resilience building strategies for children and adults, and also for vulnerable population groups such as seniors and newcomers and refugees. So now I'll be discussing how we can help children to build resilience. Before I begin, I want to make sure that resilience is a skill that we can build by practicing it. So although children are a vulnerable cross-section of population who may be struggling with various disruptions to their routines and anxiety surrounding a global pandemic, and although this pandemic has created a challenging situation for both parents and children, but I believe that this is an opportunity to build children's resilience. So as Dr. Shafi Bhuya said that every difficulty has an opportunity. So this is the time, this is the opportunity for children, not only children, for all age group of population to build resilience within themselves to cope up with this any kind of distress situation and to practice how to keep their mental health healthy. So just one moment. Yeah. So I'll be discussing about 3R. So I'll be discussing about 3R. These 3 R's help the children to build resilience. The 3 R's are relationship, routine, and also resilience building by learning new coping skills. So I'll discuss very briefly these 3 R's. So the first R is relationship. Maintaining a positive home environment and establish good understanding with the children and spend quality time with them. So by doing all this, we can create a positive environment in our home that would be very helpful for children's physical and mental growth. So let them to connect with their friends and caregivers and also school teachers by using different kinds of social media platforms or different kinds of video chat, online video chatting. And there are a couple of tools to engage with our near and dear ones. So it's not only important for adults or elderly person, it is also very important for children. So that these activities allows children to socialize and they won't feel alone during this crisis. The second R is routine. So build a daily schedule with the kids that includes regular time for their learning lessons, kind of school lessons, their reading, movement, their other kind of entertaining activities like reading books and journals and healthy meals, and also room for hanging out together. So when children get adapted with this routine life, they will find themselves in a proper schedule that help themselves to become busy with their daily life. So please be sure and be consistent with the routine with the kids specifically. Routine is very important for every kid. And the third important thing is resilience building by learning new coping skills. So learn and practice behavioral regulation skills such as mindfulness, breathing exercise, labeling emotions, and visualizations. So these techniques are meant to be learned, and these techniques are not for children only. These techniques are referred to all people, including adults and elderly and vulnerable population, all of them. So if we practice, then these activities will help us to protect our mental health and to navigate us through this difficult time. And also make sure to express confidence to children that this crisis will end, so that they have a positive energy within themselves that they will return back to the normal world and in near future. So, okay, so now I'll be going to talk about the young adults and adults. So young adults has found to be more vulnerable when it comes to negative impact of public health measures when compared to other population groups such as children and adults, because young adult is such a age group, like from 18 years to 25 years. So they are hyperactive, enthusiastic population group. So when different kinds of public health measures such as closure of universities and social gathering, this type of public health measures has taken, so it has a great impact on young adult people. So research found that COVID-19 pandemic showed that in the different kinds of research that alcohol use increased for young adults age 18 to 25. So not only alcohol use, it's also applicable for other types of substance use. So this is a very alarming situation for youth and young adult population group. And the left-hand side graph, you can see that youth of OECD countries express greatest concern about mental health impact of COVID-19 crisis. This is the first bar that focused on the mental health. And you can see that the bar is the highest for youths or young adults who are living in the OECD countries. I especially talk about OECD countries because we are living in Canada, and Canada is an OECD country. So I pull up this data, especially for OECD countries. So it's I want to mention that it's not only about the OECD countries, also for non-OECD countries, the mental health also is a big issue. It's not that much small. So, so I have talked about young adults, but adult mental health is also at stake in terms of economic losses. Dr. Shafi has already discussed that many people lost their job and they find themselves in great trouble in terms of to run their family, to run their livelihood. So economic loss is a very huge factor that has an impact on mental health. So by building and practicing resilience, this population group will learn to recover from stress and anxiety, as well as from other mental health problems. So what they can do, I would suggest they could follow 4-step measures to become mentally healthy. The first step is building connections or supporting responsive relationship with family and friends. Even though we are all required to maintain physical distance, it is important to call, to video chat, to email, to write letters to the people who care about, to engage in responsive interaction, and to protect our emotional well-being and manage the stress of living through this challenging time, through this crisis time. So the second steps I would like to talk about is to learn the coping skills. So coping skills are such as deep breathing, meditation, visualization, self-talk, and goal setting. So there is a term called SMART goal setting. SMART means S for specific, and for measurable, A for achievable, R for relevant, and T for time bound. So by defining our goals and by defining these SMART goal settings, one can also overcome their goals. And that is actually a very important factor to keep people mentally healthy. And the third step is to adjust thought process. So it means that we have to maintain an optimistic outlook. Positive thinking will help us to focus on hope and visualize better times ahead. I know that this situation is very overwhelming and we always have different kinds of negative thoughts in our mind. So when we have any kind of different thoughts, just state the negative thought. Think about where it stems from. And also you need to offer 3 positive alternative thoughts for each negative thought. So it will help you to think positive, to being optimistic, and this is very important for keeping the mental health in a good state. And the fourth important step is focus on physical wellness. So physical wellness is directly related to the mental wellness. We'll all know that. So it is necessary for us to prioritize sleep, focus on healthy eating, maintain hydration, and remain active. So in addition to daily exercise, do fun or mentally stimulating activities to enrich mind and spirit. For example, you can play an online card game with a friend or family member, or work on a puzzle, or spend some time in gardening, or you can find another kind of hobby or skill that engages your whole self. So what I am trying to say that my key message is make self-care a priority. So this is the key message for specifically for adults and young adults. So my next targeted population is the vulnerable population group. So we all know that COVID-19 had a hard hit on vulnerable population groups such as elderly people, newcomers, immigrants, and refugees. So special attention needed to be given to these population groups. Previously, all I have discussed, those are individual level strategies. However, for the vulnerable population group, it is imperative to take multi-level strategies, such as not only individual level, but also interpersonal level strategies, community level strategies, and policy level measures. So there is a need of collaborative approach from all levels to support this vulnerable population group. So different community organizations like Access Alliance are relentlessly working to mitigate struggle of refugees and newcomers by ensuring their basic needs during this pandemic. Nonetheless, continuous support from provincial and federal government are needed during and in post-pandemic period to assist the vulnerable population to overcome their struggles. So in conclusion, I want to mention that we all are passing an uncertain time, and we don't know when we can return back to our normal life and what will be the after effect of COVID-19 pandemic. So therefore, addressing the mental health as well as the physical health is a priority to better live our present and future days. We all have positive and negative outcomes in life. And through building resilience, we need to ensure the positive outcomes taken in the upper place, then the negative outcomes. So just like you can see in this picture, so there are positive outcomes in life and there are negative outcomes in life. And the middle, there is the fulcrum. So it is upon you what you want to do. If you want to have your positive incomes in the upper place than the negative incomes, then you need to move this fulcrum. So it will not move automatically. It's upon you what you want to do. So just do the things that I described earlier to keep your physical and mental health in a good place and to become healthy, not only physically, but also mentally. Thank you so much. And this is the end of the presentation. Thank you.
Thank you, Dr. Fahana. Thank you so much. Amazing presentation. So now we are going to ask to start our question. We have a lot of questions from our audience. And I see the first question for our audience is from Dr. Shafi. So there is Dr. Shafi, could you please say a bit more about empathy and how is that a game changer?
Great terminology invented. During COVID, resilience, equity, and food security, empathy. We loved it.
Dr. Shafi, you are mute.
You are on mute.
Yeah, so even 6 months we forgot to mute, unmute. So this every day happened. We mute, unmute, just exercise left, right. Anyway, I was so excited. I was start talking without unmute, unmute. Okay, good. So yeah, good point. As I told you that COVID gave us so many lessons. One of the most important lesson is togetherness and collaboration, right? So what happened before the COVID? Oh, think about like IMG viewpoint example. Oh, IMG cannot get job in this country. It's very pretty. That's it. Finish. I am just let it go. And second type of people say, oh yeah, IMG is very highly skilled and they should be provided, and let it go and go home and forget everything. Third stage, the people like you and me, we think, okay, I feel your problem because I'm also one of like you. Let's make a dialogue. Let's talk. And how do I feel? So then your feelings and my feelings is the straight same line, the same page. Then we can help each other. Let's engage to do something. And what is it? Let's improve our skill. And that's the skill we develop for ITMD program. That's the example of best example I can see. Four people, if you think four way, somebody is pity for this immigrant. Second, people think, oh, I feel is a problem. But third group said, oh no, I only feel. Let's talk to find out the way. And then let's engage. You see, this ITMD program is now everywhere. Everybody knows. How it's possible? Because your engagement is not me, is not the program. Is you engaged yourself to do it right, to make it stronger. Same thing. COVID, we have a lot of things. We come together. Now we talk about everything. So now we will find a way, and now we'll help each other. Then we'll succeed together for sure. I can tell you that the COVID will win this battle, and we have just time or months or weeks maybe ahead, but we shall win this battle because we feel each other problem, and we feel we need to get together again. We feel we need to grow, and we feel we need to learn. That learning together and grow together is the boost here, the vitamin here, vitamin D here, so to shine our prosperity. That's why I said empathy and compassionate afterward. So you have to be compassionate to do that. So just not like first person in the subway who met you, oh yeah, ITMD is a problem, IMG is a problem. That's it, and he's go train, and he leave the station, and you still on the journey. But in the train, you can see I'm in it, you in it, so we are stronger. Then let's conversation start. We don't get up, run off the station, blow. We'll go up to the end of the journey. So together. So by this time, we have a long period of time, lagging period maybe, but we'll find the solution. Because I always said nowadays, ITMD is for ITMD. So medical doctors can help medical doctors. You have idea. I have one idea. You have one idea. So 5 ideas merged together, we can overcome these things. And this is working. Our people are showing their charisma, their capacity. You can imagine that this is a great country. People are together. Wherever you go, you will find the similar-minded people here. Right? Yeah, Ali Raza? You agree with me?
Yeah, definitely. You always point to great and important information, and thank you very much for sharing with us this perspective.
Yeah,
I really appreciate it.
Yeah. Information is the key to generate to make a new idea, new knowledge. And we all here is a knowledge broker. We just try to advocate something because I cannot give you money. I can give you some information what's going on. Then you use this information as your data, And data will give you evidence-based suggestions. Many times, Farhan, I'm glad that she mentioned evidence-based medicine, evidence-based practice, and how to do that. This is important. This is the era. We all looking for the impact. We call it evidence-based medicine is working, So that if we have something, and then why we are not moving ahead, you can say, but we are moving, but maybe slowly, very slowly. You cannot say we are not moving, we are moving. Culture also moving, culture also changing very slowly. But you could look at this, 5 years ago, ITMD has nowhere, so far I know, in my opinion, where they will go, they don't know. Now ITMD has so many options, just opposite action. Now what they will do, they will go for master's, PhD, job, whatever, entrepreneur, whatever. They have a lot of opportunity. I cannot list up 100, 200, I can list right now what ITMD can do. Can you imagine? That is the beauty of togetherness, because we learn together last 5 years, 7 years. That's why government is coming to us. Can you imagine? COVID Commission, they also reach out to us to give our opinion how we can improve and include this workforce for a good reason to develop our country. So again, so our compassion work, our empathy work. So sympathy is not enough. Sympathy is just, oh, I feel sorry for you, that's it. But empathy, you will work together, feel together, and then you work together, act together. We need to act now. You know, politician always said, let's put the shovel on the ground. But who will prepare the shovel and the ground is the we. So we are not a politician. We cannot say, let's do it, let's do it. I rather said, work together now. If not now, then when? If not we, then who? Ask yourself these two questions. You will find the answer. Does it make sense to your empathy?
Thank you.
Thank you so much. Thank you. Absolutely. Thank you, Dr. Chaffee. So our next question is for Dr. Sueta. It's coming from one of the audience. Dr. Sueta, when you think of food insecurity on a national scale, the magnitude of the problem doesn't always resonate. So is the COVID-19 pandemic making worse the situation?
Thanks for the question, Magdalena. Yes, I think it is, because as we saw, even there are a lot of organizations who have been doing research on this. Foodshare is one of them. Proof is the other organization. So with the research results that they have got, it is obvious that COVID-19 has worsened the magnitude. When it was 1 in 8 individuals who were getting affected before by the food insecurity, now it's already 1 in 7. And there are a lot more people trying to access the food banks and the resources available, and not all are able to get it as well. So during COVID, if we look at the statistics are actually progressing upwards. It's not stable, nor is it going down. So COVID-19 has worsened this magnitude of food insecurity issue. And there are organizations who are trying to address it and change the policies. But yeah, we don't know when that's going to happen. Might be a long drawn process, because food insecurity has been there for quite some time. And COVID-19 has just shown that it could get worse in the coming years.
Thank you, Dr. Sweta.
And Dr. Sweta, in your list, I request you to add Access Alliance as a community partner, because we have a great Food with Dignity program. There, during the COVID, we provided free food to people. We reached them at people's door. And Gisela, she's the manager in the west side at our west hub, and Rezwan, they worked relentlessly during COVID period to prepare food for more than 150, 200 people, and we took that food to their doorsteps. So you can add in next presentation anyway. Name of Access Alliance, Food with Dignity program. Thank you.
Yes, I'll definitely do that, AKM, because it's not easy to take up such initiatives and do it. So yes, it's an amazing job.
Thank you. So we have another interesting question. This one for Dr. Chaffee. So let's say from our previous experience, that is from Spanish flu 1918 to 1920, how long can we expect it to take for individuals to become economically stable again?
Oh yeah, very difficult question. So honestly speaking, we not only Canadian, most of the leading countries, G8 or OECD countries leaders, they are not thinking maybe it will over next year. It will be 2 to 5 or 6 year even may continue. So honestly speaking, we don't know. What we are doing is very short-term basis taking the action, even not even mid-term, very short-term. You can see last week we don't know Ontario is going to shut down again. Last week, just last week, even Wednesday we don't know. Thursday we came to know something happening, and Friday everything now again back. So we don't know next 2 weeks actually what will happen eventually. That's why they are making the day by day effort to make a change, to make an impact for Canadian. I think as a Canadian, we feel proud. Our leadership is so on, so adopt with the system, what's going on, what it takes. They're not thinking about the money. They're thinking about your life, our life, and all life matter. You see, previously it was shut down, and we took measure to control. Now almost you see school open, other facility, grocery open, everything open. Now we'd like to see how it works, how we can make distancing, not without closing the school, not closing the shopping mall, just only closing the restaurant to dining, so that sometimes people got overexcited. They want to enjoy with their friends and family, so that little bit, when we together. That's why we postponed our ITM gathering this year. Two events, actually 3 events, cohort 10, cohort 11, graduations and welcoming, and also maybe we need to do virtual mix and mingle this year in December. So I will work with people. Maybe this is a different era we're entering. So maybe it will be better even we can have instead of 75 people, maybe hundreds of people can attend. That will be also better to see everyone just in one screen, right? It's even better. Not one world, one screen, not in one room, one screen. It's more closer. So we have to change our strategy, as I said to you. The time and the world will never be same as before. We need just solidarity. We need to new mindset to adopt ourselves. That if I can speak my friend, and if I listen his or her voice, my family, that may be blessings. So because every day is the good day. Thanks God that I wake up this morning with suit and tie and I can speak globally. That is the most beautiful thing I can ever expect. I don't need anything more. So why we so much worried? So you need to be positive. You need just to satisfy what you have. That's my comment. But we don't know for sure what will happen. Nobody knows actually. So if anybody is a fortune teller, maybe they can tell. I cannot tell. Science can also working hard, and also making some evidence. That's why we can guide it by the science, by the evidence, so that we can be sure we are safe and secure. But most of all, we need to change our attitude. We need to create global solidarity. And WHO always saying to us from the beginning. But many people criticize WHO changing their mind. They're not changing their mind. That's what it is, what it is. So it's changing. Somebody said, is it airborne disease? Somebody says, is this disease? So it's still debate. So we never know. But anyway, I hope everybody enjoy every moment. So because this is the one we can do. We have no control over anything what's already decided by somebody, from the God. So, but we need to adopt and adjust ourselves.
Thank you, Dr. Shafi. I will say. Our next question is for Dr. Farhana. If Dr. Farhana, if the second lockdown appear, maybe we're almost, what the people should do to maintain a healthy lifestyle?
Okay, thank you so much for the question. It is a beautiful one. So yeah, most of the things I mentioned in my presentation, what we can do to keep our mind healthy, specifically our mind healthy. I didn't focus on that much on physical wellness, but on the mental wellness. So it's a very important question because I believe we already enter into the second wave period because the cases are rising much more higher than ever before. Like yesterday, it was almost 2,550 cases in overall Canada. So it's a very high amount of number. And I think we are going to maybe in the lockdown phase again. I'm not sure, but I'm just thinking of it because the cases are rising so fast. So what we can do, the thing is every people have their unique response to stress and anxiety. So some people can handle their stress and anxiety and any distress situation very well, but for some other persons, it may be very difficult. They find it very difficult to encounter any kind of distressful situation, and they become anxious and they become stressed. And as because it is going through for a long period, like it's been almost more than 7 months, we are in a state of emergency, and then the second wave is coming, and we will be maybe another few period of like protective measures, and also I don't know, lockdown maybe. So the thing is, what we can do is to keep ourselves physically and mentally healthy. So for that, for like immediate stress relief, I would suggest deep breathing is a scientifically evidence-based exercise that relieve your stress level and relieve your anxiety immediately. So what we can do, the science behind that is when you deep breath, when you inhale, oxygen goes to the vital organs of the body, like the brain, heart, and gut, these things. So what it does, that it slows down the central nervous system, and it stimulates your parasympathetic nervous system so that your anxiety and stress goes away immediately. So for like whenever you feel angry or you feel anxious, whatever you can do immediately is take a deep breath and just to stop yourself for 5 minutes, at least for 5 minutes, to think anything else. That will keep you remain calm for that period. And for the second thing, to keep to remain healthy and to become living a healthy lifestyle, what we can do to activate our behavioral events. Like it is a very, I think it's a very tough term, behavioral activation technique, but it's the easiest thing we can do. It means that activate your behavior, whatever you like to do. If you like to do gardening, do gardening. If you like to do reading, dancing, or listening music, or playing with your kids, or any kind of thing. So behavioral activation means just active your behavior. We do it unconsciously every time, but the thing is you have to do it consciously. Like whenever you are stressed, whatever you feel like I want to talk with my parents when I'm feeling stressed. So for me, the behavioral activation technique is just on my phone and call to Bangladesh and talk to my parents. That's my behavioral activation technique. So I need to do it consciously, not unconsciously. So this is very helpful technique for keeping you healthy and like not mentally, also physically. And another thing I want to tell everyone that make self-care a priority. It's the most important thing during this crisis period. It's just self-care, self-care, and self-care. I know that the people who are having kids like me, I have a small kid, so it's very difficult to do some self-care for yourself because we don't have time. We have to do everything, do our job, do the household work, to look after the kids. So it's we don't have any time. But the thing is, if you do self-care, if you have some spare time for you, it will make your mind fresh. It will give you a new start of new day or new work. So just make self-care a priority, even for the 5 minutes of a day or 10 minutes of a day. It will be helpful. Like for me, I'm practicing to be mentally healthy for a long period because I'm in the mental health field. So for me, this type of small things is very important. So whatever I do when I for self-care, for me, I'm just giving you an example, a small example. Whenever my kid sleeps, I take not long, like a long shower that makes my mind healthy and makes my mind fresh and keeps me away from all the stress and anxiety. And the other important thing I already mentioned, that is the connections with the family members, with the friends. It is much, much important because during this period, we all are away from office. We are all away from our near and dear ones. So what happened during this time is we become exhausted when we don't able to talk to people, we don't able to meet our near and dear ones. It actually creates stress in your brain. So what you can do, just talk to your colleagues whenever you have time. In the work time, no problem, you just have a quick 5-minute Zoom chat with your colleague. And for my office, I have a specific 1 hour time in the end of the weekend, that is on Friday. That is, we called it chat and chai session, that we all the employees virtually meet together and just they gossip. Whatever that is, that we miss our workplace, we just chat in that period. So this is a very good wellness activities that can keep you like to be with your near and dear ones, with your colleagues, with your family members. And the other important thing I want to mention is the positive thinking. So positive thinking is, this is a kind of thing we need to practice. So it cannot come in one day. So it is a thing of practice. You need to practice it day by day. And at a point of time, you will understand that you can divert your thinking. You can reframe your thinking. When a negative thought comes to your mind that, no, I'm done with all of this, I cannot do anything more, I have done all these things, then you can just divert your thinking and you can think like, yes, this is a very bad phase for me. Maybe I'm passing a very bad time, but with the other good things that happened to me, I have built a very good connection with my kid. I can spend more time with her. I can spend more time with my husband. So these are the positive things you need to think. Just reframe your thinking from negative thoughts to the positive thoughts. So you need to train yourself with this. And if you can do this practice, it's like magic for any kind of stress and distress. And obviously I mentioned about routine and family bonding and defining goals. So defining, Sweta asked me a question. So defining goals that we actually use in mental health practices, especially with the people who have mental health problems. But this is also evidence-based practice for any kind of population. In previous pandemics and epidemics, there are research on these SMART goals. And whenever you can define your goal, like a short-term goal, not a long-term goal, like you define that I'll do this work, I would do this 1 page of writing at the end of this week. So this is a small goal for you. This is a short-term goal. So what you can do, just define that goal and make a time period and think that if I can achieve that. So if you practice that, then you will have all of your works done at the end of the day. And that is so much relieving from stress and anxiety. So yeah, these are all the techniques I'm currently thinking, and I'm sure there are other things too. So just the main important thing is make self-care a priority. Self-care is the ultimate practice that you can do to keep yourself healthy. Thank you so much.
Thank you, Dr. Farhana. There are a lot of questions, but unfortunately we are running out of the time. Dr. Abby is gonna collect all the questions, and for sure we're gonna receive the answer. Thank you so much. 3 powerful, yes?
If I can jump in quickly. In the chat, you have the email address to which you can direct the questions, and we will reach out to the presenters, and from there we will give you the answers.
And the answers will be directed to everyone, all the participants. We'll forward the answer. And last moment comment from the panelist, 1 sentence. And can I request Gisela, who is the owner of this program today? So just after the panelist, 1 sentence, you can have a complimentary statement for today's. So 1 statement from each of the panelists, just 1 sentence. How do you feel today?
Dr. Sweta?
Okay, I was hoping the other would. Okay. I had a great time with this session because it was a lot of learning for me, not just the topic that I did on, even from Farhana about mental health and about the economic recovery from Dr. Shafi. And it was also a good time because I got to meet other fellow professionals in the similar industries. So it is a worthwhile 1.5 hours that I took on a long weekend. Thank you for this opportunity for Access Alliance.
Dr. Shafi?
So yeah, I just want to extend my heartiest thanks to all the panelists and host and our listener, our fellow friends and colleagues. Again, I said, you are my inspiration. So please keep doing what you're doing.
And Dr. Farhan?
Yes, for me, it's a very good opportunity for me. I'm here as a panelist with my mentor, Dr. Shafi. So it's like it's a dream comes true for me. So yeah, I feel very privileged, and thank you, Dr. Ekem Alamgir, for giving me the chance to speak here today. So I think that's a very good session and a very good learning session for me as well. Thank you so much, Access Alliance.
All credit goes to Magdalena and Abby.
Thank you,
the host,
Magdalena and Abby.
and host Gisela Benzaghi, who is the host of this program for today, and she is running this Community Health and Wellness Week. And I request for the closing statement from host, and then Magdalena will close the meeting formally. Gisela.
Okay, well, thank you so much, AKM, and for making this happen in a very really short time. And I want to thank Magdalena for moderating this discussion. It's an important and timely discussion. And in particular, I want to thank Swetha, Farhana, and Dr. Shafi, for your thoughts, your inspiration, your commitment to sharing, your thoughts about how do we ensure that a healthy recovery that works for everyone, especially the most vulnerable and the people more affected by the community, that we have those strategies at hand and that we are able to share those with our communities. We work with the most vulnerable immigrant refugees and members of the community, including the non-status. And all of this is going to inform, our organizational path. And we hope that, I've been doing some tweeting, and I'm hoping that this will bring the discussion to the social media, arena. I don't know how to call it, like the social media world. But thank you very much, everyone, for taking time of your long weekend to share with us. It's been really great. Thank you so much.
Thank you, Gisela. And okay, this is the time to close. So thank you to the panelists. 3 powerful topics working together. So we know that the economic impact can affect mental health, and it's also at the same time food security can be affected. So we hear an amazing words: empathy, build resilience, compassion, and as the Dr. Shafi said, it's the time to work together. Is the time to work to act together. So thank you so much to the panelists. Thank you so much to the audience, and thank you, and have a beautiful day.
Thank you very much.
Have a great weekend.
Happy Thanksgiving.
Happy Thanksgiving to everyone. Thank you so much.
Yeah.
Thank you so
Bye.
much.
Thank you.
Bye.
Bye.